options for women who are unhappy with their previous breast reconstruction surgery?
Well, the good news is there's almost always options, and it really depends on what's bothering you about your previous reconstruction. So I'll give you a few examples. Sometimes with a implant reconstruction, it's just the implants over time have settled a little bit. The position may not be as perfect as it was immediately after surgery, or your body has changed a little bit with time, and now you either want a smaller implant or a larger implant. So that may be as simple as just adjusting the implant position, doing an implant exchange to the size that would get you to the place that you want to be. Other times there were complications with the reconstruction. There may be a little bit of scarring in the tissue. The patient may have developed a capsular contracture, had some issues with an implant. And then oftentimes in those situations, we're looking to exchange the implant for a natural tissue reconstruction.
Great. So let's talk now about more, kind of treatments, breast cancer treatments and their impact on timing or ability to have breast reconstruction. So in particular, starting with chemohormone therapy, does that treatment impact, people's ability to get a breast reconstruction and potentially the type of breast reconstruction they can get?
So it doesn't impact the ability to get the breast reconstruction or the type. Radiation can play a little bit of a role there because radiation can increase the chances of capsular contracture significantly, 2 to 3-fold. And so oftentimes if a patient has had radiation, we'll educate them on that, and we may decide not to use an implant for their reconstruction. But chemotherapy and hormonal therapy, all options are still open. It can affect the timing though. So, if you're undergoing a staged reconstruction, for example, like a tissue expander reconstruction, so you had a mastectomy, the tissue expander was placed, or if you had a mastectomy and a deep flap was done, but you're planning on undergoing a nipple reconstruction, if it's determined that you need chemotherapy after surgery, everything is kind of put on a pause there. You undergo the necessary treatments, and then reconstruction resumes once everything is completed. Hormonal therapy is a little bit different. We can actually, depending on the hormonal therapy, still operate while the patient is undergoing hormonal therapy, because oftentimes it extends for months after chemotherapy has been completed. So hormonal therapy is a little bit more flexible.
And you did mention that radiation kind of limits a bit the options, right? So, anything to elaborate on that one beyond what you just said?
Yeah, so this comes down to, I've certainly done breast, and most plastic surgeons have done breast reconstruction on using an implant on someone that's had radiation. But this is where, informing the patient and, shared decision-making comes in. So we'll always educate the patient that, the risks are higher. But for some patients, that's kind of the way that they want to go. They understand that the risk of capsular contracture is higher, the risk of wound healing complications is higher with following radiation, especially with an implant. And so we all go into it with open eyes, and if there's any issues, they're dealt with on the back end.
And perhaps linked to that, or more broadly, can you tell us more about where research is going in this area? In other words, what is happening in terms of breast reconstruction field? Where's the research? What the future looks like?
Sure. So I think the breast reconstruction now compared to even 10 years ago has certainly evolved. The implants have improved. The biologic mesh that we're using as part of implant reconstruction has improved. The techniques for autologous reconstruction have certainly been refined. And there's more people performing the more refined techniques than there were 10 years ago. So, which is great for patients, because if there's more people performing these surgeries, it's a little easier to find them and to have all of the options available to you. I would say that some hot topics in breast reconstruction right now, one of them is sensory restoration of the breast. So especially with natural tissue flaps, trying to restore the sensory nerves, which are basically cut during a mastectomy, and repairing them with neurografts to the tissue flap that's moved up so that the tissue flap has a little bit more sensation afterwards. It's never normal sensation of a breast, but any improvement is certainly beneficial. So sensory restoration is certainly a hot topic. There's a lot of research now also on quality of life issues after breast reconstruction, comparing different techniques, different modalities, and using validated surveys to assess patient, work function, their sexual well-being, their psychosocial well-being, their physical well-being before and after surgery to see what the effect of breast reconstruction is on them and whether one technique is a little bit better than another technique.
Is there, actually, this is really interesting, is there any early data on the quality of life, or that's just still, kind of data being collected?
Breast reconstruction definitely improves quality of life, both immediate breast reconstruction and delayed breast reconstruction. Although immediate reconstruction in many studies has an advantage because a patient has the reconstruction immediately after surgery.